Medical marijuana is illegal in Australia, yet supply networks are popping up around the nation, along with calls from patients to legalise it. In one particularly remarkable case, a man who endured a world-first operation to remove a tumour the size of a football has won the support of his neurosurgeon and oncologist to use marijuana to treat his pain. Queensland and Victoria have now joined a New South Wales trial on medical cannabis, which will run next year. But patients want the legal risk removed now. Connor Duffy reports.
It's breakfast time in Wollongong and Paul Lawrence is making his daily smoothie. There's the usual ingredients, as well as a surprise finish, a garnish of freshly chopped marijuana. In 2010, Paul's life changed forever when he sought treatment for back pain. He thought he'd hurt his back working as an industrial roofer.
After the MRI, I was found to have a tumour the size of a football growing on my spine, and to be honest, as bizarre as it may sound, I was just as surprised as anyone. I thought I was a roofer with a bad back.
Paul Lawrence had a rare spinal tumour called a chordoma. It was so massive it was compressing his spinal cord and pushing through to his stomach.
The initial diagnosis was, really sorry, but you've got about 2 months and it's going to be slow, horrible, painful death. You're going to lose use of your limbs, your lower leg, your legs in the next week or two. Then you'll lose bowel, bladder.
When we first met, he was terrible. He could barely walk. Significant weight loss. He looked emaciated. But the primary issue, as far as he was concerned, is that he was in horrible, agonising pain. This guy was on industrial doses of all sorts of happy pills, and for him, life was basically coming to an end.
After 2 bouts of surgery taking about 45 hours, Paul Lawrence was transformed.
The pink material is the reconstructive scaffolding that is used to hold him together while the bone grafts...
Most of his tumour was gone, but so were 3 vertebrae linking his upper and lower spine. 5 ribs and a leg bone were removed and recycled to replace them.
We harvested pretty much everything that we could find. We harvested muscle, vessels, bones, pretty much from his shoulders, his chest, his legs, to plug into into the void that was left with the tumour.
He's amazing. I mean, he travelled daily, obviously from Wollongong. Someday he came with his partner, but someday he came by himself on the train. Never complained. He had a huge pain threshold.
Today, Paul Lawrence has a quality of life that astounds his doctors, but it comes with constant pain.
That's why I'm always going to be in pain, because people think my back's sore all the time. My back isn't sore all the time. I can permanently feel all the structures in me. It's uncomfortable, but it's not the agonising part. Where my bones are missing, that hurts like hell. It's about 6 hours since I had my last medication, and this is the whole plant, cannabis oil. As we said, we're not just talking about marijuana. This is
Paul Lawrence is a lifelong pot smoker. He now relies on hash oil and smoking to relieve his pain, and says giving up the cocktail of painkillers and sleeping pills he was prescribed has transformed his life.
After about a month of not taking the medications, it was like a fog started to clear. And I just looked back at what I'd not been doing for the last 4 years and thought, this is ridiculous.
Despite scientific uncertainty, many others with chronic pain believe marijuana is more effective than opioids.
Since I've given up pain meds, I ride a push bike. I get in the water and try and swim.
Paul has the backing of both his doctors, who caution it is only for a limited group of patients and can have serious side effects like lung disease and mental health impacts.
In terms of what options does this guy now have, well, we don't have much to offer him. However, with his ongoing symptoms, if he gets benefit out of pursuing alternative medicines, whether that benefit is real or perceived, if he is getting benefit, then he has my full support to pursue them.
I'd like to have to be open-minded about this. I think certainly I can see it seems to work really well for Paul. I think on a large scale, the best thing to do in this situation is to have a clinical trial.
Dr. Niall Wheat is a pharmacy expert from Sydney University who says medical marijuana can treat pain and other conditions.
It's definitely a potential alternative. There have been several studies in the US already that have shown in states that have legalised cannabis that overdose deaths from opioids have actually dropped significantly, up to 30%.
However, he wants people to wait for a trial before using marijuana themselves.
The side effects can be quite disastrous. There's a lot of studies that have shown long-term side effects from cannabis use: psychosis, anxiety, depression, and impairment of both cognitive function and judgment.
But users like Paul Lawrence, who believe medical marijuana works, want it legalised to cut out the risk of prosecution that deters others. His own prognosis is uncertain, but the push for medical marijuana is keeping Paul Lawrence motivated.
I could dwell on a lot of things that have changed in my life that are bad, or I could choose to think about all the things I still have that are wonderful. And, you wake up every morning and say you're good, or you can say you're bad. I say I'm wonderful.
Connor Duffy reporting.